Ladies and gentlemen, a very warm welcome back to another SASH conversation from the couch. Today, I am absolutely delighted to welcome two more budding presenters who are going to be joining us at our conference in October. I'd like to introduce Adam and Daniel, and I would love you guys, a warm welcome to you guys. I believe both from Utah today, is that right?
Yeah, that's right.
Well, a warm welcome, a very warm welcome, because it's probably hotter there than it is here.
Very warm.
Guys, listen, it's so exciting to have you join us in October. Why doesn't one of you kick off and tell us about the title of your presentation and what it's going to be about? And you're both welcome to join in here.
Sure. Yeah, the title of our presentation is going to be the distress quadrants for assessing and treating problematic sexual behaviors. And essentially where this came from is we as a clinic do treat a lot of people coming in seeking help for problematic sexual behaviors, and the predominant literature and models from 10 years ago, 8 years ago, kind of pinned everyone into one area saying like, hey, they're gonna come in, they're gonna be minimizing their behaviors, probably lying to you, this typical sex addict, you know, that terminology that maybe we've moved away from using in the field, will need to be really have their feet held to the fire, right? Like they're coming into therapy because these natural consequences are catching up to them. They've been fired from work, or their spouse is super angry with them. And so a lot of treatment were revolved around helping them develop empathy, kind of pushing them in that direction. And this really crazy things started happening, which is we started noticing that a lot of clients who are coming in seeking help for problematic sexual behaviors weren't really acting out very much. There wasn't a whole lot of natural consequences happening, like not a lot of time, money, or mental energy being invested in seeking out these behaviors like pornography. And we started to identify that a lot of their behaviors are actually, or a lot of their suffering was more self-imposed distress, meaning things like their belief systems were causing the suffering, or the rituals they go through to repent or make up for having acted out or screwed up were actually causing far more distress than any of the actual consequences they're naturally experiencing. And it really got us to start thinking and saying, hey, we probably need to approach these clients differently. And this addiction model stuff actually is causing harm for a lot of clients, not really helping them out. So what we did is started creating these several different scales. We're looking at like what's causing their distress, where is it coming from, and then really trying to curtail treatment and customize it for those clients so that we could help them rather than unintentionally cause more harm.
That is, I'm loving the sound of that. I'm an addiction recovery coach, and I work specifically with men who like you, who come to me usually because of sex addiction, compulsive sexual behavior, whatever you want to call it. Yeah. But I also recognize that the why to me is a lot more important. And I love working to help men come to terms with one of the most notable things is self-hatred.
Yeah.
And it's, I mean, I've struggled with sex addiction. I'm in recovery from sex addiction. It's taken me the better part of 17 years to really settle into my body and stop hating myself. So what I'm hearing you say is resonating very strongly with me. Adam, do you want to share a bit here?
Yeah. So I think what we're looking at here is this idea.
Hold on 1 second. I'm looking after someone's Labrador, and this beloved 14-year-old dog is just, Fritz, go away. No, go on. No, go away. Go away. No. There we are. That's good.
Both Adam and I have dogs here too, so I'm assuming this will be about the first of about 5 times we get interrupted by dogs.
Well, he's old enough to know better, and I think when he sees I have got no cookies, hopefully he's gone back to his bed now. Fritz, no, go away. Go on. No, go on. Go on, Fritz,
all of my dogs are in a different part of the house, but they would be jumping on my lap if they were in here. I've got 3 that live in the house. So.
Well, Adam, anyway, do please continue. I hope his name is Fritz. Let's hope he pushes off.
I want to look at this question of why what we're talking about is relevant to sexual health.
Beautiful. Yeah, that's a second question.
Yeah, in reality, we know this as mental health professionals or as a coach, our perception is everything. So if a person is coming in because they're immensely distressed about their own behaviors, sometimes it's not just that they feel out of line with their values, but they feel this, like you're talking about, self-hatred, this deep shame, fear, this helplessness. But a lot of times you look and their behaviors, coming across to a clinician, they don't look really, the level isn't clinical at all. Or even the average person on the street would look at their behaviors and go, I don't know, this seems fairly normal, how you're interacting with your sexuality. But on the other hand, you have some people's distress maybe primarily because they feel that they're suffering unreasonable consequences, maybe at work or in their relationships, because they don't feel that their sexual behaviors or lack of sexual behaviors or however they're interfacing with their sexuality are really that problematic. And everyone else around them is saying, wow, man, you're out of control. So there's this whole spectrum of how people perceive themselves and how they're perceived in their relationships, whether it's romantic, family, work, or whatever. So in my mind, overall sexual health is tied not only to the actual sexual behaviors that a person's doing or not doing, but also to how they and their partners perceive the behavior. So this distress quadrant approach that we're looking at, it basically helps us better target the areas causing the distress. That's the whole goal of this subsection of our overall treatment model, is let's evaluate where the distress is coming from. So how much of it is internalized consequences or self-imposed, and how much of it is that they're experiencing real world consequences and are either distressed by it or are not distressed enough by the consequences that are experiencing. So the goal here, help the therapy clients, help the stakeholders in their life understand the nature of the distress, find for themselves an approach to their own sexuality that really matches what we want to see as an evolving value system. Most of our therapy clients, their value system is often getting in the way of their own health, whether because of family of origin issues or societal expectations or whatever. So we want to help them evolve their value system. We want their behaviors to be socially responsible. We want them to be intentional about their sexuality, not out of control, and generally free from consequences. And this is sort of building on Bill Herring's model of categorizing chronically problematic sexual behaviors. So in our minds, at the end of this treatment process, people will be able to be comfortable and confident in how they're engaging with their sexuality, and that they have enough self-awareness now of why it was creating distress that they can then prevent themselves from going back into that in the future.
You've just given me an entire lecture, which there's so much beautiful information there. Secrecy is something that you talk about sources of stress. For me, in my acting out over 30 plus years, it was secrecy and trying to hold together the proverbial pack of cards and keep one secret safe from the secret I've told somebody else, to keep that secret. Oh no, she knows. Oh no, can't. Oh no. I mean, the stress of just trying to keep on top of my secrets, let alone the self-hatred and the shame. But
we talk quite a bit. Okay.
No, go for it.
We talked quite a bit about secrecy behaviors as part of the external consequences, and probably being one of the biggest categories we see as we're dealing with couples or individuals in relationships, because those secrecy behaviors so impact attachment and the ability to have meaningful connection, and that which further drives isolation and more acting out behavior. So we're big fans of the secrecy part.
We're afraid to get too close in case they find out our secrets, or worse still, who we think we really are. It's tragic. Beautiful. Guys, what would you like participants, if any maybe 2 or 3 specific things, what do you hope participants will take away from your presentation?
I think the first thing we really want our participants to take away is that there is no one-size-fits-all solution for treating problematic sexual behaviors. Again, as we've talked about multiple times so far, even in this little interview, motivations and antecedents for acting out behaviors are so varied. We really want participants to take away, there's different ways to approach each client, and that will provide the best care. So for example, if we have a client who's maybe a little higher in narcissistic skills and lower in empathy, right? We are again going to want to help them learn to develop empathy and to work on attunement to others and work on their relationships. Whereas we might have this client who spends so much time beating themselves up after minimal acting out behaviors. We're going to want to maybe work on helping them to be more compassionate for themselves, right? And we're going to want to work on those domains where intervention matters most, whether it's values, evaluation, behavior management, like for that client who leans more to that narcissistic path, empathy training, social responsibility, shame resiliency, as you've mentioned several times, client empowerment, maybe expectations management for some of our clients who are really dealing with perfectionism. And again, their beliefs about their behaviors are causing the distress. So it's a big thing we want to look at. Is, again, no one size fits all solution. So let's conceptualize and give our clients the best treatment possible.
Love that. Love that. Adam, would you like to add anything to that?
I just think, I think it's a beautiful thing that as years roll on and people are thinking more holistically about sexual health and not just about stopping certain behaviors, right? Like, I'll be fine if I just quit these behaviors. I think it's a beautiful thing to evaluate human beings from all of the different angles of health, which are both promotion and prevention oriented. Promotion of I'm going after who I want to be, and prevention, yes, there are sometimes that there are things in my life that I'm doing that are getting in the way. And so, excuse me, need to get some water. I think for us, an approach that looks at both internal and external consequences, but also looks at what does this individual need to be able to heal is so much better than saying, look, everyone is the same. Here's what everybody needs. Just follow this path and you'll be fine. Because we notice that as clinicians that if you just take a one size fits all approach, you're going to get fired by 25, 50% of your potential clients in the first 3 meetings because they will intuitively know that that's not what they need. So having a responsive treatment approach is just incredibly useful, and that's the goal here, is to create that responsive approach.
I love that. I'm sitting here having flashbacks to my very first treatment center in 2004. And I remember sitting there being told by one particular therapist, let's call him Bob. And Bob would say, yes, Mike, eventually you'll stop all these behaviors and you'll be healthy again. And that pretty much would have meant I couldn't have sex. So I was quite keen to have a healthy life and enjoy sex. Today, with my clients, it would take a lot to shock me considering what I've done in my life. So when someone sits in front of me and says, I'm doing this or doing that, as long as it's not actually dangerous to themselves or another, I sit there and go, okay, well, that could be really cool. But why don't we talk about a few other things and look back a bit and see what's driving that and see if you still feel happy with it. I love the more holistic approach and not demonizing whether it's a man dressing as a woman, whether it's playing with a pair of handcuffs or whatever it is. There are so many fetishes. Whatever it is, just stop judging the outcome and look. Desmond Tutu has a great quote, and we're welcome to use this one. He says, we've got to stop just pulling people out of the river. We have to go upstream and figure out why they're falling in the first place. And I love that. Just zaps for me. So guys, so love your holistic approach, and so love you both have a very kindly and gently demeanor, which has got to be helping your clients too. So it's lovely to meet you guys. Guys, before we finish, a little question, last question. Is there anything that you would like people to know about where you guys might be appearing, anything notable you're going to be involved with before our conference in October or even after? Where can people connect with you beyond the walls of your treatment center?
Yeah, sure. So this distress quadrant model is actually a subset of an overall treatment approach that we've been developing for years, and we are finally at the point where we're starting to train on it. So It's called ARM5, or Adaptive Recovery Model. It's a 5-phase approach. Excuse me. And so
I've got some water right here if you'd like to.
I know. I need
That's right.
I'll have a drink for you.
Please.
Well, since
That's really
you're
good.
on the top, you're on the top view for mine. So if you pour it, you know, we can get it down for all three of us.
I'm on the side, so you'll have to throw it over here. But I think, you know, we're excited to be finally starting to train this model. We, in fact, just coming up in a couple of days, we've got one. Every few months, we do an introduction training to the ARM5 model, and we'll be doing those via Zoom and also in person in Utah. So if people are interested, they can reach out and find out how to get involved in those trainings. And in the long run, we're going to be developing a whole series of trainings, including intervention workshops, a multi-day training on therapeutic disclosure of secrets. And, you know, we've been running a clinic here in Utah for 8 years now. We've got 5 locations, and we've seen enough clients. This is kind of our main specialization, that we feel like we've got a pretty special approach and model now that we're developing, that allows therapists of all different of all different approaches, types, styles, methodologies, to be able to utilize what they're already good at doing and how they like to approach therapy, and integrate this. It's not so much an intervention model as it is, what's the terminology, Dan, here that we want?
Framework.
A theoretical framework that explains how people get to where they were, and how they get to how they evolve or to health. And yeah, we're excited to start doing that. So you'll see us starting to show up at various conferences. And if anybody's watching that organizes conferences, hit us up. We'd be happy to come speak. So
beautiful, beautiful. Guys, would you like to share your website just as a final opportunity to spread the word?
Sure. So our clinic in Utah is Utah Valley Counseling. For those that want to get involved in the training, ARM-5, the number 5.com is the organization where we're doing these presentations, so they can check us out there. And we're happy to get involved in SASH. This is our first year coming, so we're looking forward to it.
Gentlemen, it's fantastic. So loved talking to you, and can't wait to meet you both in person in October. And thank you for stepping out and coming to our conference for the first time. It's very exciting for us.
We're excited. So thank you for having us.
Gentlemen, listen, take great care. Keep safe over there. Try and keep cool as the summer bears down upon you. And we'll see you in the slightly cooler month of October. But for now, it's a goodbye from me. And thank you for talking today.